begin today with Medical Center Hospitals taking care of you. Renne Elfert is here with us, and so is her personal physician, Dr. Stephanie Kubacak. Ladies, thank you so much for being here with us today. Renne, I guess the first most obvious question is, why are you willing to share some of the things that are on your heart and some of your health struggles? Why be so open?
Well, Tatum, I lost my mother back in March in her early 70s, which I feel is far too young nowadays. And a lot of her medical problems, I think, could have been prevented or certainly less complicated had she had the tools and the support to make different choices earlier in her life. So I've decided that now it's time for me to look into getting some help and support and see what I can do to make sure that I don't have to struggle with some of those issues. Yeah. And Dr. Kubacak has been wonderful. She's so dear, and she has really helped me and supported me and given me the confidence and the courage to go through and know that it isn't too late, that I can make a change.
Tell me about a couple of the things that have been detected or determined that you're really going to start focusing on.
A couple of the things that we do know is that I do struggle with high triglycerides, a high cholesterol, and that I am showing some signs of early osteoporosis, which I know is a lot of women my age struggle with, and it's kind of a postmenopausal thing too. And so those are some areas that she's working with me on right now.
Okay, so Dr. K, I love talking about this because are they pretty common? As Renne said, as we start to age, there are some things that happen to most of us.
Yes, I think so, unless we really prevent it before we get to menopause. By going in yearly and looking at family history and really trying to eat properly and maintain exercise. But yes, usually we don't look at that, and it's when we're in our 50s and this is quite not right.
Yeah, you start to realize that but the good news is it's never too late to make some positive changes and start to turn things around, right? We want to make sure people realize it's never too late.
That's right.
So when you're talking about osteoporosis in general, what are some of the tips that you tell people that can help to strengthen bones and is it always the back? I mean, what's the misnomer about osteoporosis? Because we have this mental picture of the rounded back.
Well, unfortunately, we don't usually screen for osteoporosis until we're menopausal or age 50. And so there are a lot of people even under menopause age that are suffering issues with osteoporosis or osteopenia. But, insurance kind of, tells us we can only check it at those two parameters, or if we've lost height or had a vertebral fracture.
Okay.
But as we go through menopause and our hormones change, our bones don't turn over as well, and we don't put down as much bone. So we really have to maintain exercise, weight-bearing exercise in particular. Just doing cardio without the weights is really not all that helpful.
I've told you, this was an aha moment for me, because you think weak bones don't lift anything heavy, don't, but it's the opposite.
Yes, that's right. I was really amazed in the past by a woman that came in with a negative 2.5 on her bone density test, and she was in her 60s, and she says, well, I'm going to reverse this. And she went and got a health club membership and did weight-bearing exercise every day, and got on her calcium and vitamin D, and I'd be darned if she didn't change it. So I have seen proof that you can reverse it, but it's much better if we can prevent it before it occurs.
You mentioned vitamin D. I've heard you talk about that's one thing you're also working with. Vitamin D, common for women to struggle with low vitamin D, or something to keep our eye on?
It's common for everyone to struggle with vitamin D if we're not getting it in our diet.
Okay.
In the past, we were told, well, we're close to the equator, we get lots of sunshine, we should be getting the vitamin D from the sunshine. Well, I really have not seen that on testing that everyone's getting vitamin D from the sunshine. So I really, really think that you have to drink adequate either dairy products or something that's fortified with vitamin D, or take a supplement.
Okay. Renne, before our time is up, I want to talk a little bit. We're about to see Renne take her first trip to the gym, and I know that's important to you that we stay physically active. Were you nervous going in? Because, I think about, the girls in spandex and their looks. It just makes me cringe. Were you nervous, and then what was your reality?
I was nervous. I was really nervous. I think just the thought, just going in, and there are a lot of cute women running around in Las Vegas. But really, it was, I found that wasn't the case. There were a lot more people there that were around my age. People were dressed a little more comfortably. Sure, you've got your precious ones, but I just sat back and looked at them and thought, I'm going to look just like they are pretty quick. So yes, you just had, it's all about your attitude and how you take it. But they worked with me so well. It's just a very comfortable environment, and they're making it very easy for me. So I'm actually really enjoying it, and I look forward to it.
Good. Ladies, thank you so much for being here. Dr. K, Renne sings your praises, and so we appreciate
so kind.
the health professionals who are helping us all get on a better health pattern for 2014. Thanks, ladies, very much.